Hello, I'm Mindy Mesmer. I am chair of this subcommittee, the Health Subcommittee for the HB737 Commission. Before I get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of this committee, I find that due to the state emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12 pursuant to executive order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I'm confirming that number one, we're providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing GoToWebinar for this electronic meeting, and all members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. The public has access to contemporaneously watch and or listen to the meeting on GoToWebinar and via telephone by the following directions and links provided on the General Court website. We've provided public notice of the necessary information for accessing the meeting in the House calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are any problems with access. If anyone has a problem, please email Amy, A-M-Y, .russo, R-O-U-S-S-E-A-U, at des.nh.gov or call 603-848-1372. In the event the public is unable to access the meeting, we will adjourn and reschedule. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. Can anyone jot down some notes on this for me, if you don't mind, because it's hard for me to say it and do it at the same time. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I'm Mindy Mesmer. I'm in my office alone here in Rye, New Hampshire, although there are other people in my home. Honorable Nancy Murphy.
Good afternoon, everyone. I am in Merrimack, Nancy Murphy, in a house full of many people, but in a room by myself.
Great. Representative Gary Woods.
Hi, I'm Gary Woods. I'm in Bow in my study, and I will be by myself in my study in just a moment. My wife is picking up something, and she's on her way elsewhere in the house.
And Katie Bush from DHHS.
Hey everyone, Katie here in my office in Concord. My colleague is on the other side of the cubicle wall, but I'm in headphones.
Great. Great. So we'll get started. Did everyone receive the agenda and the minutes from the last meeting? My horrible minutes from the last meeting? Okay, great. Amy is not going to be with us today, so I was just going to start by first seeing if we can have a motion to approve the minutes from last March 29th. Representative Woods, thank you. Do we have a second? Great. Any discussion on the agenda, on the minutes? Seeing none, do I have a motion to approve?
Well, I thought we did. I so moved.
I guess I was, never mind. Okay. All right. So that was you were motioning to approve. I get it. All right. All right. So we'll just stick with that then. I got confused. Great. So minutes are done. We're having some difficulty with note taking in all these subcommittees. So what we're doing is we're hopefully, I know this is being recorded. I'll receive the recording after the meeting. And if anyone can send me your notes after, even if they're just scribble notes, that will help to put the notes together for the next meeting. You can see my notes are not great, but at least we have record of the meeting. So that would be helpful. So getting to the agenda for today, we don't have that much. We'd like to keep it to an hour if we can. Just some old business, new business, and a little bit of talk about legislation that's underway. Setting a time for our next meeting. Is there anything else that, I guess when I get to the new business, we can say, or at the end of old business. So getting into the old business, we received the letter from DHHS about the serum, the blood test samples, and they're going to be retained, which is great. Is there anything else, Katie, to fill us in about that? I think it said 5 years or something, or, okay.
Yeah, the plan was going to be from 5 years from the receipt of the last letter, so in February. There's been no updates at this time. I know they were working on sort of a mail merge out of the database and then working on drafting what that letter will look like. So, but yeah, I was excited too that we kind of reached a good
That's good.
consensus.
One thing not to worry about for now. Oh, I did want to discuss, Nancy Harrington let me know that she wasn't going to be in attendance today, and that is because Nancy Murphy got elected to the town council, so someone has to replace her now in the commission. So I guess that's an issue for the larger commission, but she wasn't going to be here today, unfortunately, just to let you know. So Nancy, is there anything that you want to update us on with regard to the Saint-Gobain permit issues, or anything public health related that you want to update us on?
I believe Eileen Cavanaugh, the town manager, made an announcement at the town council meeting on Thursday evening that Saint-Gobain has submitted another variance request. And I don't have the specifics, but I do know that the town manager was not happy that was happening. So, and as far as Councilor Harrington, I actually just texted her because I didn't know she was going to miss the meeting. And I don't see a reason that she should be able to stay as part of the health subcommittee. But I think the issue is that there isn't another place for a town council member on the commission. So that may be something we're gonna have to look into with the unfilled positions on the, in the bill. I know there was a number of seats that weren't filled, but so I don't know. I think I hate to not have her here because I think it's been a great asset to the group.
Yeah.
So
So continuous, a little continuity break if we don't have her.
Can you clarify, sorry, are you both now members of the town council? But so you may
Yes.
not both be able to serve as members on the full commission? Is that what
Agreed.
we're?
The
Yes.
issue is that Nancy Murphy was a community member, and the bill specifies a community member that's not elected. So that's why that's happening. So unless there's another space, I asked her if she knew, or we should probably look at that. If there's another way that we can have both continue to be on, it'd be great. But I just have a question, Nancy, for you. The variance request, a variance on what?
I'm not even sure. The town manager was getting the email during our actual the meeting. So I'm actually going to be meeting with her tomorrow morning, and we'll get the specifics that I can share with the group. It was an in-process thing. All I know is it was a variance that they were seeking from our town's planning board, and
On the pad or something, maybe?
yes, and something. Yes, it was something that was, and the town they pretty much Saint-Gobain gave them an ultimatum, kind of, that needed to get approved quickly, and the sense the town manager had was that wasn't going to happen. That wasn't it was going to, things were just going to follow the usual protocols for permitting and that kind of stuff. So I'll get the specifics of the information either later today or tomorrow when I meet with Eileen Cavanaugh, and we'll share.
Okay. Yeah, I noted that when I went through that stuff, there were some concerns on the part of the fire chief on the access to the facility and all that stuff.
Exactly what it is. There was an exterior sets of stairs or something that they were trying to not put on in the time frame that needed to happen. And I know that Eileen Cavanaugh was concerned about our firefighters and said that we're not going to put firefighters at risk for a convenience of a Saint-Gobain.
They've had like 6 fires or something like that, right? In the past few years.
It had a number of fires. Yes.
Great. Any other comments on permit issues from anyone? Or anything Saint-Gobain related? So as a result of the March meeting and the response by DES on the bottled water issue, I just wanted to update on what I found out last night, I think it was, or yesterday. There were additional homes, now a total of 613 homes are on bottled water or offered bottled water in the area. I don't know the status of the letters that were to be sent out to people who lived within the consent decree area, but we updated our visualization tool to include the St. Gobain consent decree outline area, as well as the new people who are eligible for water. And if you look at that tool, it's pretty interesting to see the drastic marked stop of people that were offered bottled water on the border of the consent decree, and then people in Londonderry in particular that quite a few that are raising concerns now about the fact that their PFOA exceeds the standards, yet they don't have bottled water. So I don't know if there's any updates from anyone on that, or anyone heard about anything. There's a few in Bedford that are similar. There's a few that were added. The biggest addition over the last 2 weeks were people from Londonderry. There were 3, I think, in Litchfield, and then there were about 26 or so in Londonderry, I think, or something like that. So Bedford, a few. But I don't know if anybody's aware of the status of that outreach. Too bad Nancy's not here, because I don't know if they ever got the letter. Do you know, Nancy Murphy, if, because I can get that to them now. I know how to get that list of people who they've not heard back from yet, if they want to, if the town council wants it and they're not getting it.
I know Nancy did mention at the town council meeting that she thought it would be a good idea for the town council to support in those letters to support testing for all of the people that concerns of people that were not notified. But I don't believe that she had received that yet.
Okay. So can you also check and see if she knows anything about that, and if you guys need it, I can help get the info to you. Great. Anything else on that bottled water issue? Moving on, trace study DES conference on the 19th and 20th. Last time we talked, and I apologize, Katie, if I'm putting you on the spot and you've already talked about this at the last meeting, but I can't remember. Any additional information on outreach strategy, and wondering, I had an idea, could they come, actually I put SB 85 commission, but thought somebody could come present to our commission. I think we talked about that together, yeah.
Well, and maybe it's an opportunity for a joint presentation. I thought maybe that's what you were thinking, maybe even. I think that would be great. So if we wanted to think about an invite, I can certainly go back to them and ask, probably June is what, after their presentation, and then, because we meet, when is our next full meeting? Probably in 2 weeks or so, right? May 14th.
I think they're looking at May 14th, yep.
Yeah, so.
But I didn't see a final yet.
Yeah, the 14th at 8:30 in the morning, I believe.
That's right. So I'm happy to ask them about a presentation, maybe for June, targeting June. And I think a joint meeting would be awesome. But if we, if HB737 wanted to host it, and then SB 85 members could join, something like that. That's what we did, I think, when the birth registry folks presented to SB 85, we invited HB737 to attend during that meeting time.
I think that'd be a good plan too, because I think
if we want to report that out. Yeah.
The SB 85 commission's pretty full on presentation, so it might be good to have the 737 do it.
Yeah.
Katie, last time you said there's some interesting analysis about PFAS. Can we talk about that at all, or should we just wait till the?
We should wait till the presentation. And by interesting, I just mean that we were able to do some kind of sub-geography analysis, knowing that that's going to be of interest to the commission. And there are patterns up here, different, but we should have the presentation and have the data in front of us to talk about. Of course, the thing to note is that the sample size is really small, right? So, for example, I there's 250 households in the entire study. If we look in southern New Hampshire, I think there's something like 40 households represented across kind of the 10-town area that we know is higher risk. And so we just have to, that's going to be a main point and a main limitation of any analysis if we try to compare statewide findings to anything kind of sub-state level, then the sample size is certainly a limitation. So, but I think the data is still useful to kind of inform, our understanding broadly of differences in risk. So that's something we could definitely plan on around the presentation.
Do you happen to know if they did a similar study in Vermont or Maine?
Don't think so. I know they're not funded by the National Biomonitoring Program. I think the only state I know of up in this neck of the woods is New York. I was just jumping online. There usually CDC puts out a map of kind of who is funded. So Massachusetts was funded back in 2015, and New York was funded in 2019, but other states are not funded by the National Biomonitoring Program. That doesn't mean that their health departments may not undertake some biomonitoring studies, but they're not, they don't have this large 5-year grant to support their work like New Hampshire does.
Has New York reported out yet?
I mean, New York does a lot of work. I can't remember the details. Not everyone opts to do like a statewide analysis. Some do very targeted, maybe like children's exposure to PAHs or something, like they can be very targeted in their study design. So I am not sure of New York's priorities. Let's see what I can find here. They'll assess statewide exposure, well, to PFAS actually, and metals. So but no, I have not seen any reports from them.
Is there a contact person? Or is there a way to talk to somebody about that?
Yeah, I can, let's see. If you just, all I did was Google state biomonitoring, CDC state biomonitoring grants. I can either add this to my blurb of notes if you want.
Yeah, that'd be great.
Sorry, I have noise in the background. I don't know if you guys hear that a lot, but
It would just be interesting to see how the results, since they have Hoosick Falls, if they did a similar study that included Hoosick Falls and compared that to the rest of the state and then compared that to New Hampshire. It'd be interesting to see, since I'm not sure the timing of, can't remember what the Hoosick Falls facility start date was. I think it's similar though to the others, and that ChemFab was there and they took over, and so the length of time of exposure would be similar in the same, and similar time and similar in type. So it'd just be interesting to see how their results compared to ours.
yeah,
I mean, I know it could be a way to improve the sample size type thing.
yeah, we could also, if we're inviting biomonitoring, we could ask, in preparation for that meeting. I know that the states talk to each other like on tracking. So it could be part of the presentation, or it could be a follow-up to the presentation, but I can certainly include some contact information.
Representative Woods, go ahead. Sorry.
Katie, do you know, are the sites that these various databases are using, are they fairly widespread around the state, somewhat randomly, or are they guided in some way?
Well, so it's a competitive grant application process where they have to put forward their whole project plan, and then as part of the decision around funding at CDC, the project value is sort of vetted and evaluated. So in a 5-year plan for New Hampshire, for example, they put forward several projects.
Yeah, okay, so you don't really know this. The reason I'm asking is I'm just thinking of myself. We live near Bow High School. Turned out the high school was sited on the old highway facilities area, and it was juxtaposed to a dump. The dump was closed, the transfer station was moved elsewhere. when they finished up with the highway, they just didn't get all the salt out. They just sort of buried it. And that contaminated a well so much that the folks that built this facility, there's 26 standalone homes. It's a condo, but they're standalone homes. They were so contaminated with salt that had to be re-drilled about 400 feet away. It's just about 50 feet. The new drill, our new well is about 50 feet from our house. The site of that is about 200 feet or even less from the old dump site. And it would be of some interest to see if long-term some of this, if anything, is leaching out. Like we heard at the last business about the Dalton and the 2-mile radius for dumps. It was stated there's only two kinds of dumps: ones that leak and ones that are going to leak. And that's true. And if it comes up, I would like to raise my hand to because we're self-managed and we look at the water care. We don't use it for drinking water, but for irrigation. And it's very easy to sample. And I used to do it myself. I've changed jobs. We're self-managed. But at any rate, if it comes about, it would be, I think, since we're less than 200 feet from the actual physical dump, that well.
So you said it's not the drinking water source, though?
No, we get from Pennachuck, and that's brought in. This is just for plant irrigation, but it would be, I think, interesting to see what's going on.
Mm-hmm. Yeah. In Rye, unbeknownst to most people in town, our biggest supply well is 800 feet from an old unlined dump. And we have PFAS and what I would consider to be too high, sort of, over the back and forth over the threshold.
Yeah.
For PFAS. So it's a big problem. There's 300 unlined landfills in the state of New Hampshire. And DES told us that 77% of those have been tested for PFAS and positive, found to have PFAS in them. So it's a big issue. I don't know if that dump was actually a dump or is it a salt dump, but if it's a dump, then it most likely has PFAS in it too.
No, this was a dump. I mean, a true dump.
Yeah. All right. Yeah. So that would be good to be able to compare to other states if possible, especially if they did something around Bennington as well. I'm not sure if the state itself has, but moving on, if there's no other comments on that, to the ATSDR community survey. Any word on that, Katie?
Nope, I have no updates there. I'm sorry. Yeah, we'll talk the first week of the month with our federal funders, and so I can check then, and we'll hopefully have an update at the full meeting.
And next is there any update on updating the 2018 cancer report?
Well, so I was just going back through our notes from last time, and I think I just need some clarification on, it wasn't clear to me if the question was, has an update been done? Can an update be done? Or when will an update be done? So I guess I'm just not exactly sure what it is.
Yeah, so the time frame for that was 2005 to 2014.
Right.
And we've been told that updates can happen every 5 years, which would give 2019, and we're 2 years from 2019. So the data should be in there now, right? For the most part. So we had asked if we could, when, how, if, all those questions about the cancer report incidence rates for the next 5-year time frame.
And we are specific to this is the Merrimack. Yep, you put the link in there. That's super helpful. So just I want to make sure, because they had issued a number of kind of those reports at around that time, but specific to the Merrimack area.
Right. the 2018 cancer
So
incidence.
yeah,
report.
I mean, I have enough time for our full meeting. I can certainly reach out to the cancer program and ask for any updates around their thoughts on that, and then be prepared to report out at our full meeting. I know the report goes into detail around best practices and kind of preferences around methodology, but I do recall also those conversations around updating it when there were more years of data available, which, like you said, is now. So I can certainly ask and see what their thoughts are there.
Any other discussion on that?
It looks like good information. It's just, I was interested myself to see what the status is.
Any other old business, if we're done with that topic that I neglected to put into the agenda that we should cover? Great, okay. New business. Well, this is kind of old business, actually. The toxicant database, looking for more help with that. I know one of the students isn't quite working on it as hard as I'd hoped, and I know that I have another student who probably will work on it this summer starting. I put the link into the agenda for our database that we started. There's been a new development in the, I think it used to be called the endocrine, what was that called, Katie Holmes? I can't remember, but they did their own tox database. It just went public in the last few days.
I mean, the endocrine disruptors?
Yeah, they're called the Endocrine Disruptor Network.
Disruptors, yeah.
They folded, but they continued to
did?
work on, yeah. But they did continue to work on that database, and it is public now.
Well, you know why they folded?
It was a couple of years ago. I think they're, nonprofit. They couldn't, the funding wasn't there, so.
Oh, that's a biggie.
Yeah.
Vinny,
Just
you're talking about
as a sidebar, I tried to bring that up and it wouldn't allow me access.
Oh, I gave you access. I'm sorry. I don't know. I have to get my son to help me figure out how to effectively share that stuff without requiring people to get approval each time. I just don't know how to do it. So I apologize.
It said, click if you want access. So I clicked and it says, we'll notify you.
Oh, it didn't notify you? Oh.
And I didn't, I looked at my emails, both legislative and my regular, and
well, try and click on it right now. You should be able to get in, even though it didn't notify you.
See if I can do this without, let's see here.
It should let you.
Yep, it did. There we go.
Good. Awesome.
Good.
Sorry about that.
No, it's okay. I just, it looked like it would be a good link, but I just, thanks.
Yeah, this is something that the SB 85 Commission is working on, the data subcommittee. So I'm actually going to put that link in there right now for the, if I can, oh darn it, if I can figure it out, with the PFAS tox database I was just talking about. So we have it in there. But we need some time to, so the way this started, Gary, in case I don't remember if you're around for these conversations, apologize if you were, but the last iteration of this commission, we had found the NIEHS tox database table. And with the change in administration, we think it got taken off of the website. So then we said, well, we'll just make our own that's, for New Hampshire anyway. So that's how we started doing this. So it's not just PFAS, but it is partially PFAS. And, with this new information too, it'd be helpful to get all of this information in one place that's relevant to New Hampshire.
Right.
So I also have a separate, so there's a Google sheet that people have been doing for COVID-19 that's a scientific reference list that's updated all the time. And I thought for us that would be helpful as well. So I started that and was asking one of the students to help with that as well. So we'll see what happens over the next, but if anybody knows a student that's looking for a thesis project or, you know, a school project on drinking water or whatever, forward them to us so we can get somebody to help work this out. But so they have a good way. They have, you know, 4 different places they can start looking for stuff right now and start putting that in. They don't even have to research, just start, you know, putting it all into the database. So any other old business, new business?
Do they have a timeline on that project?
Which one?
Oh, the putting the new database together.
The Keene State, it's, you know, based on the school. So that's the one student that's supposed to be doing it now, you know, it's the end of this semester. The next student is going to start in the summer.
Okay.
And then it's going to go into the fall, but I'm not, you know, more than one person doing it is helpful too, because there is a lot of information to do.
Okay. So, to be determined.
Yeah. So if there's any UNH students or anywhere, Plymouth State, anything that anyone can think of, that would be helpful. Anything else? Any other new business that's not on the agenda? Nancy, no new business?
Nothing big stuff. No. Got it
Great.
covered.
Okay. Anything about regulations? Katie, do you happen to know about the bottled water up rulemaking? Is there a schedule for that yet?
I think that it's aligning with the kind of just calendar. So I recall from notes previously that by next December, that was the goal. So I think that those, I can ask for a formal update on the timeline, but that's my recollection of the original timeline. I think that corresponds to some other industry work happening. So update on bottled water rulemaking.
You mean IBW industry work?
I think just other, maybe, I can't exactly recall. I feel like it's in my notes from last time. I don't want to misspeak here, but just other work that the food protection program is doing around the industry. Something I think expires, and so they're working on it for December 2021.
Okay.
But I will write to the food protection program and ask for an update.
Katie, when you said by next December, did you mean December 21 or 22?
That's what I recall originally.
21?
I know I submitted some of these informal notes to the full commission over time, and I have then lost track of my answers. So can go back through some of those old notes.
Well,
I don't think that their timeline would have changed for any reason. So I can either try to pull those up right now or.
It's okay. That's all right.
No,
don't worry.
Yeah, so from March, I say that they're just planning to undertake rulemaking. I don't have a timeline there, but.
Yeah, I'd never heard a timeline.
Back to gel car. I'm assuming it does, but.
Yes.
Don't worry about it, Katie. Okay.
Yeah, I was like, it's here.
I'm sorry, I didn't mean to get you sidetracked.
Oh, so I just realized, Gary, so just so the original copy of the NIEH summary of disease conditions and environmental toxins is pasted into that Google sheet. So you'll see it off to the right, just like a picture of the table as it was on the website a couple of years ago. So that's what we're using as sort of a reference to how we were going to do it. Any other legislative news that the Health Subcommittee should be following? medical monitoring, I believe, went on to the Senate. I don't know if it's been scheduled yet for a committee hearing. Any other relevant? Bottled water bill was retained in committee. That's all I can think of. Gary, anything your committee is thinking about or looking at?
Not at the moment. Nope. Our Senate stuff is all omnibus bills, but the best I can see, there's nothing relative to our committee.
Okay.
I guess the only thing I have a question about around new business is kind of the link to the education group. And I know Mike Wimsatt had mentioned starting to hold like community office hours. And so I don't know, just to what extent are we kind of keeping track of what's happening, and might those meetings be an opportunity, for example, when the ATSDR risk assessments are complete, to share those? But I guess it might be nice if at a full meeting, maybe we like had a calendar or something, right? So we could think about just how to leverage those community meetings. Maybe, I guess I'm not clear exactly what's happening at those, and maybe DES has them covered, but to the extent that we want to collaborate on those or bring other information to those meetings.
Yeah, Katie, I know Mike Wimsatt has meetings scheduled for both Bedford and Londonderry. Bedford, I think it's May 6th, and Londonderry, I think was May 20th or thereabouts. And part of the things that we had talked about in the communication subcommittee meeting was a format that would allow some feedback, obviously a presentation from DES, followed by some feedback from communities, and then questions and answers. And I had reached out to Mike about that, and then found out that those two of those meetings were already scheduled. So we don't have anything yet for Merrimack. And tomorrow we have another communications subcommittee meeting. So I know that Emma Paradis has been involved because Bedford was one of the first meetings that's scheduled, and we'll hear from her tomorrow. So I know those two are happening. I don't know yet about other communities. I don't know whether there's a plan to do that in Hudson too. Now that I know that Hudson's is on the radar, but I know at least at this point that just those two meetings have been scheduled.
Do we have an agenda for either one of those meetings yet? No.
Yeah.
That's a really good point, Katie. Do you have particular items that you would want to include in the May 6th and the May 20th meetings that we should push up to them right now? Because we're not going to meet for the full commission till after one of the meetings.
Right.
So we were trying to get
I don't feel like I have topics to necessarily bring forward, but it's more around the format. And I guess I want to help ensure that it's like a listening session, and that we're really capturing community concerns, and then that we can look holistically across the communities, what's everyone asking, and then how can the agencies help answer those questions. So similar to the document I shared, I don't know that you all have seen it yet, but I did share that Q&A document that came out after we did the public presentation to Merrimack around the Apple Tree grant. And so I just think that kind of Q&A document is something that could be shared in these other communities, because they'll likely have a lot of the same questions. I mean, some of it was specific to the Apple Tree grant, so that wouldn't be relevant, but a lot of it was just around PFAS. And so sharing that document, I guess, is something we could suggest, but then to make sure that someone is sort of attending this with the goal of just listening and capturing themes, and can be in each of the meetings and then look at the themes across, and then maybe that informs some of our recommendations of, I'm imagining our providers don't know what to do. What's our advice? Or I need a well test. Where do I go to get that information? Just how can the agencies then help get that information and make sure it gets back out to residents? So
was that
that's
you that
more of a connector? Like I'm just thinking about how to connect the dots across the meetings.
I think that's a really good idea. There should be somebody there listening with the, and that's the purpose of that grant anyway, too. So who
Well,
would
I
be-
can't offer that grant necessarily, but just that's
Yeah.
the example in my mind of a meeting where we did that and then we put out a document. And so to just, I guess I hope that Emma and Mike and maybe Nancy, you can be our link there of just what is the plan to kind of capture concerns across the multiple meetings. Because
Yeah.
that to me really could inform our recommendations as a commission then. Like these are the things we're hearing. So.
Excellent point, Katie. That's what I had thought, and that's why we had the communication subcommittee had talked about after DES presents. Obviously, we had a very active citizens group in Merrimack. Londonderry has now their own. I know Bedford has sort of Emma has been sort of spearheading things there. So I thought we thought that it would be important to have a section of each of those meetings devoted to addressing community concerns. And then, questions and answers will come at the end, but not all the questions will get answered in the time frame. So we sort of foresaw maybe a plan where the citizens groups in those communities can provide the feedback to, what in this case it's DES. But I know that a lot of the feedback and a lot of the concerns are going to be public health related. So,
Right.
that was our thought was, should these meetings be DHHS and DES? Or should DES do whatever they're going to do, and then we follow up with, with
Right.
DHHS, and because I think it's important to have both groups there. Sorry, somebody's walking by my house. Dogs are going crazy.
Yeah. And whether we're there or we just make sure that we capture it and distill it down and get answers, I think that's what we want to make sure happens. But so yeah, what's the role of our subcommittee, I guess, in helping facilitate that? You could
how
let us
do
know,
we,
Nancy, after the education meeting meets tomorrow, I guess, kind of what the thoughts are.
that's a communication meeting,
Yes.
but
Oh yeah, sorry.
Yeah.
Communications.
Yeah.
how do you normally get to work with them to do that? I mean, how would we facilitate that?
I think it's mostly a question for Mike and Emma of kind of who's organizing it and setting that agenda and also just making sure that someone's on to be the note taker. I think it's really just a role of our commission to be suggesting that we capture the concerns kind of thematically across the meetings. So, I mean, I can also follow up offline with folks here who are planning it and just explore opportunities to support that. I don't want to step on anybody's toes, right? Where this is kind of, it feels like what is it? Education, outreach, commission.
The communication one. Yeah, no, I don't think
Mike.
we'd be worrying about you stepping on anybody's toes actually, because we were trying to work. Nancy, if you want to comment on this, you could provide some background to this a little bit more if you want, but I don't think it'd be stepping on toes.
No, I think it would be helpful. As I said, I think, a big part beyond the, what does this mean for my well? What's, that drinking water issue? It's the health impacts and the concerns around that for animals, for people, for, many of the things that you've heard. And DES seems to have done this on their own. So the planning and the format and the schedule, et cetera, were DES initiated, and I only found out because I had written a note to Mike Wimsett saying what we'd like to, get together. Communication subcommittee would like to get together with DES to sort of strategize a format that would meet the needs of each of the communities and to clarify who those were. And that's when I found out that the 2 meetings were already scheduled. So I think it's important that the communication subcommittee have some input into. I know from at least Merrimack, I think that it's important to have DHHS, either be present at the first meeting or at least we're planning on a follow-up meeting to address whatever comes out. And I don't know what you think, Katie, whether one way is better than the other, and do we take the notes from the DES meeting and then say, okay, this is what this is the need, and do we have then a separate meeting based on that? You know what I mean?
Well, and I don't know, I guess, because I know Mike gave an update at the last full meeting, but I think it really, sometimes there's really specific things that really it's DES's expertise that's needed, right? And if it's around the testing and the remediation and some of the legal issues happening, you know, it really depends on the focus of the meeting, I guess, and the intent of these office hour meetings. And I guess I didn't know if the meetings that Mike was planning with DES is what also what the education group is thinking about, or maybe there's separate meetings, you know, that are more broad, kind of a general outreach meeting to the community versus this very specific time for community members to ask very detailed things of DES. I mean, it seems like there's often like multiple modalities and multiple kind of topics are useful, right?
Right.
So, yeah, I only meant to try to connect the dots and unsure really what our role is as the health subcommittee, and all this I've felt like just out of the loop a little bit, but we don't have to all be everywhere either. Nancy, I guess you're our link there, so.
I think the point's well taken that we need to coordinate everything, and I think it's beginning to come to a focus. And especially with what communications meeting tomorrow, is data going to be meeting before the next general meeting?
Data for the
I mean, this one
SB85.
health group.
Anyway, it seems like if they're meeting before the next general meeting, full meeting, could be a point of departure in terms of a next step, putting everything together. If we could, if enough background work's been done.
I don't think there are any other meetings other than this, than the
Yeah.
communications one. I think that's it, Gary.
As far as I know, but I wasn't sure.
Yeah, yeah.
Well, and it's probably all right to let the Bedford meeting, you know, be a pilot, and then we can plan the other meetings and switch it up if we need to, or, because I forget when you said the first one is actually happening.
That's May 6th.
So there's,
Pretty sure.
yeah, so,
May 6th.
and then not till the 20th though, so there'd be some time to.
Just for my own refresher, the May 6th meeting is DES and who?
Bedford,
Bedford.
the town of
Okay.
Bedford. Yeah.
Okay.
So I certainly took down as action item to just connect with DES partners here, and kind of ask if they see a role for us or what they really are envisioning for that meeting. And then we can circle back at the full meeting, if not beforehand, if after tomorrow's meeting.
That was going to be my next item on the agenda. Do we want to meet again? And if so, do we want to meet before the next meeting, or maybe the 7th, if people want to get after the Bedford meeting, but before the next meeting and before the big commission meeting, or assuming it'll be on the 14th.
Yeah,
We
it's
have
hard
a,
for me to commit another meeting at this point. I feel like it might be valuable to wait till the full meeting and all come back together. But, and I will certainly work on getting answers to all the questions that were in kind of the first half of the agenda.
just looking at meetings. We have an SB85 data subcommittee meeting on the 7th in the morning at 11. That's the only thing I'm seeing.
Yeah, just from a
So-
resource perspective, it's getting challenging for me to staff both full commission meetings monthly and then multiple subcommittee meetings monthly. So I think one subcommittee meeting monthly is really ideal. Otherwise, we're talking about 4, you know, so that's just kind of where I'm coming from a resource perspective. It's hard if we start having multiple meetings per month for multiple subcommittees and full commission meetings. That's like 5 or 6 commission meetings, which is just, that's getting to be a little too much for what I can bring. So that's just a reality of my limitations here. Not to say that I have to be at every subcommittee meeting either, so.
Nancy, do you have thoughts?
I'm just thinking that maybe tomorrow during our meeting, we can talk about that and how to address it. Because I understand what Katie's saying. I'm not working full time, and I know the number of 3 subcommittee meetings for every commission meeting, and it sort of compounds itself. So I get it. But just so that we have an idea of really what we're looking for, what communities are looking for, so that we can target that for the meetings, maybe after, obviously, it's too soon to do that for April 6th. I mean, excuse me, for May 6th. But there's no reason we can't do. I think it'd be a good thing for us to discuss tomorrow. Just, what are we going to be looking for, and what do we think that will be DHHS for? And we certainly don't need Katie to sit in through that, but at least so she has a sense of what we're looking at and what I think tomorrow will help us identify that, and then also the information that we garner from the May 6th meeting in Bedford will sort of tell us where we need to go for the rest. And then we can certainly ask DES and say, this is what, in the interest of time and people's time, that citizens, don't want to show up at 90 meetings, but, if there's a way to get the question, citizens' questions answered. And I think the whole part, and we've said this in our subcommittee meetings, is that we have people coming in this just starting, learning, where Merrimack is way ahead and Bedford may be way ahead. So you're always sort of reinventing the wheel. And so trying to figure out a way to do that with, like Katie had mentioned, that that document that was sent out after I think that's a great way. Things like that people can have access to. We can provide links for people to have that hard copy information in their hands, and but just sort of determining what can we add to something like that. And I think some of that we'll be talking about tomorrow, and the rest I think will become apparent in May 6th when Bedford has that meeting.
Okay, so I'm going to say TBD for the next meeting on the agenda,
Yeah.
and we can come back and email about it later.
Yeah,
Sounds good.
Sounds good. That's all I had. So if any other discussion, or I'll take a motion to adjourn.
So moved.
Great. Second. Thank you, Nancy. And I'll do a roll call. I think we still have to do roll calls. I vote yes. Nancy Murphy,
Yes.
Representative Woods,
Yes.
Katie Bush.
Yes.
Great. Thank you.
Thanks, everyone.
Good to see you all.
Yes.
Have a great.
Take care.
Bye for
See you
now.
later.